Hey everybody, welcome back to more. So should you say yes to the test? If your doctor prescribes additional exams or procedures, what should you do? What should you ask him or her? Well, here with input is Dr. Ranjit Makar with University of Nevada School of Medicine. Doc, thank you so much for being here. How are you?
Thank you. Thank you for having me on the show.
Absolutely. We appreciate it. Okay, first of all, you know, I think there's a culture that we have grown up in whereby if the doctor says, okay, you need this test, we feel compelled to go get it. But things have changed, especially when it comes to research. Let's talk about that.
All right, you know, this is a very relevant question, especially in the day and age where high-value, cost-effective care has taken the front seat. Now, physicians order tests for a variety of reasons. You know, we order tests to diagnose a particular condition, see a treatment response, and also as part of preventive screening. So, what's the harm of ordering a test?
Yeah.
You know, first of all, it causes undue anxiety. You know, if it's an unnecessary test and if you're waiting for the result, radiation exposure is an important component of it.
That's what I wanted to ask you about specifically, Doc. When it comes to radiation exposure, how much should somebody have per year, man or woman?
Yeah, you know, there are clear-cut guidelines, you know, regarding radiation exposure, and you know, the American Association of Radiology, you know, has said that, you know, and it all depends upon how much you have already been exposed that particular year. Okay. So, you know, we have to follow that. In addition to the harm which is caused, you know, it prompts unnecessary testing further with procedures, which can further cause harm to the patients.
Okay. Yeah. So when we're in the doctor's office, you know, it can be very overwhelming. Sometimes it can be intimidating because you are the expert. Correct. And if you say, I need this test, then again, I'm going to feel compelled to do it. But if I'm not very comfortable with it, what should be a patient's next step? Should we talk to you? Because again, we don't want to offend. You're our healthcare provider. Correct.
And that's a very appropriate question to ask, like, you know, like, how is this test really going to help diagnose a particular condition?
Yeah.
And the physician should be more than willing to tell exactly what the steps are to diagnose a particular condition. Okay. Now, you know, physicians do order a test as a part of preventive screening, and the United States Preventive Task Force is guidelines which we as physicians follow, and they set clear-cut recommendations, you know, whether it's a level A or a strong recommendation or a level C, which is a weak recommendation.
Okay, so there is a website, there's a body of people that say whether or not your doctor should be recommending these tests.
Correct.
What is that? Do they have a website, Doc? Do you know the website?
They do have websites, you know, although, you know, patients can get lost in the intricate details, you know, but physicians should be more than willing to tell the patients, you know, hey, this is a strong level of evidence, and I do feel that, you know, you should go ahead and get this test done, and talk about, you know, what the test results hold, what implications do they hold, that if they're positive, what do we do next? And if they're negative, then, you know, when should we retest you in how many years?
Okay, love that information. Tell me the name of that organization again.
It's United States Preventive Services Task Force.
Preventive Services Task Force. Thank you. You've been a great help. That's some great information. We appreciate it. All right, Rachel, there you go.
Oh, I got you.